All right, good morning. Welcome to the Thurston County Board of Health special meeting work session for Wednesday, July 28th, 2021. It is 9:32 a.m. And my name is Ty Menser, Chair of the Board of Health. Commissioner Gary Edwards is to my left, and the Vice Chair, Commissioner Mejia, will be joining us shortly, I believe, virtually. We have slated till 11 a.m. today, and we are live streamed through our Thurston County YouTube channel. So with that, we have some new materials, and I appreciate that. We were kind of mid-conversation at our last briefing, which I think was maybe, I don't know, I lose track of time, 3 weeks ago maybe, something like that. And we were, I know the goal, I guess, Art, I'm gonna kind of touch base with you here. I mean, my goal is to kind of just jump right back kind of where we left off, but I know you have some new materials here, and I know you know where that conversation was headed. So I if you would like to kind of pick up the ball and start where you think is appropriate, I'm willing to defer to you on that.
Okay, well, that's good morning. And I'm Art Starry, the Environmental Health Division Director, and Steve Peterson, Jane Mountjoy Venning, and Shelley Slaughter are here to help with all this. And I will try to pick up more or less where we left off last time. As you mentioned, because we've been having discussions now. I think this is the fourth one that Commissioner Mejia will be involved in just this year. So the last one was on June 23rd. And the idea is to, again, kind of go over, I won't even try to do an overview of where we've been. I attached a sheet to your briefing packet that kind of, I hope, reiterated or refreshed everybody's memory as to what we've discussed before, and then we'll try to move ahead here. So
let me just do one thing, Art. Let me articulate the question that I think was kind of on the table, and you can decide when to weave that into where you want to start. But just so we're all on the same page, my memory is that we kind of left off with, I was questioning the beginning of the presentation is focused on these percentages of ROC compliance, and then we got to the kind of chart where there were different program elements that we could consider, but I was sort of saying, well, how do these different elements going to translate into a increase in the compliance with increasing that percentage of compliance with the maintenance requirements that we're looking for, and that's where I think we kind of got interrupted. So just again, you don't have to answer that right now, but just so you kind of remember where we left off. Appreciate it.
Okay, I will do my best, and so will everybody else try to address those concerns. So again, what I'll do is I will attempt to get the PowerPoint thing going here, and I got too many screens going, but I will persevere. And share my screen, and I will go with that one. And is that coming up?
Yep. Looks good.
So this is just the cover slide, but just so hang on to your hats here, because we'll get back where we left off last time, and that has to do with and if you actually want to look at these slides at your leisure, they all got updated. One of the things that we have to do each 6 months is submit a report to the State Department of Health that tells how our on-site system management program is doing. And so when we do that, we have updated statistics. So if you look, you'll see there's a few more septic systems than we told you about last time. But I won't belabor that. But if you do look at those slides, you'll see they have new numbers. And where we were left off kind of last time was we were talking a little bit about some of the other counties and what they're doing, and now we're back. So I did change a few things in kind of getting Commissioner Menser's question, or at least maybe helping frame it a bit. Last time we were talking about numbers and this percentage have current inspections and that. And I thought after talking to a few folks, it would be good to remind everybody what the purpose of all this is. So that way, if we're talking about options and what we want to do, what it is that we're hoping to achieve with that. So we'll go from here. So kind of going back to some of the discussions we've had before is, why are we doing this? We're talking a bit, those charts that I breezed through, talk about or show what percent of on-site systems have current inspections. And in some areas we have really high rates with current inspections, in some areas that we don't. But at the end of the day, what difference does it make whether you have a current inspection or not? Why do we care? And the reason is that when you do inspect your on-site system regularly, if something really bad is happening, like a failure, you can find that. And certainly that's not anything you want to find, but nonetheless, if you do, be like, having your home inspected or doing, when you go to the dentist, you hope that you don't find a cavity or that you have an infection that requires a root canal, but sometimes that happens. And so that's one of the reasons that you have regular checkups. That's one of the reasons that we want people to regularly inspect their on-site systems. And then also to do the maintenance and things to prevent future problems from happening, and also to find if there's smaller problems that can be corrected now that'll keep bigger problems from happening. And so that's what this chart shows is, and you've seen this before, and I think I finally got the formatting right, so it makes a little bit more sense. But this is the inspection report submitted by on-site professionals in the year 2019. And the reason we picked the year 2019 is because it was before COVID. And last year, when we look at some of the numbers, it's hard to know whether or not people spending more time at home, did they get systems inspected more often or not, or less often? Where because of financial difficulties, did they put off maintenance? We can't sort all that stuff out, so we didn't try. So we just went to 2019, which was, I think, a representative year. And if you look at those numbers, you'll see we had 18,000 inspections, which is a big number. And 82% of those, or 82.5% of those, no problems. 9% had deficiencies, and that could be, Jane could talk a little bit more about that if you'd like. It could be minor things where they, there might have been a crack or something in a lid or something. And then there's serious deficiencies, which would be things like loose pipes, big holes in the tank, baffles that have come off. Those things that can greatly impair the ability of the on-site system to function. And so, again, that's, why are we doing all this? Why are we fussing with it? It's because of things like this. And remember, we've got, 54,900 septic systems in Thurston County that are producing a lot of wastewater. And so it is important, and we've seen in the past the impacts that those can have and that are related to failing septic systems. And that's, most prominent usually in shoreline areas or in high density areas. But again, we've talked about that before. And this is a new chart. And this is also based on the information that we provide to the State Department of Health. And one of the things we do is each 6 months, we tell them how many septic system failures were found, how many minor repairs took place, and how many septic systems that relates to. And so you can see that going back to 2016, I went through all of our, not all of them, but a lot of our old reports and found this. And you can see that this gray or this blue box represents septic system failures. We've pretty consistently found each 6 months about 20 failing septic systems within the Henderson and Nisqually areas. Again, so that there's a lot more septic systems than 20, we know that, but still, I think it's important to see that every 6 months, because people are looking for them. And I think this is largely due to the fact that we have a regular monitoring and maintenance program in place, and people are expected to regularly inspect their systems. We're seeing failures. And so I actually looked at these numbers. It's averaged about 25.5, I think, septic systems every 6 months have been identified as failures. And this is data that we've pulled from our Amanda permitting system, and Jane could talk a bit more about that if you want to get into the details. These orange bars represent the number of systems that had minor repairs. And so you might recall that those are things that need to be fixed. They could be a cracked pipe. They could, again, be a missing baffle. They could be, maybe a fitting has come loose or a pump float has come loose and it needs to be reset. Those are minor repairs. They don't require a permit, but they can be really important as far as the functioning of an on-site system. And sometimes they can actually lead to a condition that we can find when we do monitoring that shows that the system actually meets a failure definition, where it's discharging improperly treated sewage to the ground or to surface water. So there's quite a few systems there. You can see that's probably in the neighborhood of 50 something plus. And these gray bars represent the number of minor repairs that were necessary. So that's telling us that many systems have more than one problem that they found. So maybe they had a missing baffle and a crack, or maybe they had a pump setting or a pump that wasn't set up properly and it needed to be fixed. I don't know if Jane or Steve want to elaborate any on what minor repairs are, but were there any questions about that?
I think we went through that last time, actually. I remember Gene describing all that.
Art, could you just mention how many septic systems are in this area that you're monitoring?
There are about 11,000 septic systems in the area. There's a chart earlier that shows the exact number, but it's about 1,100, 400.
11,420 systems in Nisqually and Henderson.
So it's, again, it's not percentage-wise, it's not a huge number, but again, I think we found that, especially on the shoreline areas, one failing system can really mess things up. We've had a couple of areas, one in Nisqually for years, the shellfish harvesting area, several acres was closed because of one system that was failing into a drainage system, and took a long time to get corrected due to legal entanglements. Another thing, so we were talking a bit about options, and Ramiro reminded me, or mentioned at the last briefing, that we aren't really telling you what our current program does when we should talk about these things. So I wanted to add a column here that does that. So you can see that the plan recommends all these things, and our current program is we're trying to accomplish a lot of them. So for instance, the operational certificates and time of transfer, we're doing that. That was recommended in the plan. We're getting pumper reports turned in, but our ability to do some of the things like quality assurance inspections, which are the ones where when we get those reports from on-site professionals, we follow up on the most troublesome ones, and do a check on a certain percentage of them to see how accurate they are. We aren't able to do that really much at all. The quality assurance, we do try to follow up on some of the high priority ones, but we're not doing as well on that as we would like either. The pollution identification and correction, so that's water quality monitoring to try to follow up on problems or to identify areas where septic systems are posing or are polluting water resources. Usually this is focusing on surface waters. We're doing that on a very limited basis. It tends to come in with grants. There's a little bit of activity in Henderson and Nisqually, but we are very limited on that. And that's the sort of stuff I know from the last two Board of Commissioners meetings. People have asked about Black Lake, and can we investigate or do work to evaluate drainages coming into the lake that their consultant has found might be a problem. And that's what this PIC sort of stuff would do, is it would allow us to have resources to try to find the source of that pollution, or to verify if the consultant's report is correct, and if it's associated with septic systems, work on that. If it's another source, try to work with people who have the authority to deal with that.
What is OPC? Operational
certificate.
Oh, okay, so it's same as
So
ROC, you say sometimes, and sometimes you say OPC?
Yeah, it's usually, sometimes it's operational certificate, and then there can be a, septic report. Yeah, but I think we get caught up sometimes in too many acronyms and initials.
It's not helpful when you have multiple acronyms for the same thing.
Sorry about that if I did that.
That was, okay, can I stop you on this chart, Art?
Feel free to stop me on this chart.
So this is where I left off. So I guess the disconnect I was trying to put together in my head is, so, okay, for one question is, what is because in your briefing memo, you talk about, well, if we wanted to do this, 8 FTE, if we want to just focus on shore, 7 FTE. How many FTEs are involved in the orange column of current program activities? So I can give a sort of sort of a basis of comparison.
Yeah. Do you want me to jump into that?
Yeah, I was going to say Jane is the expert on that. That's her program.
So
I'll
we
see if your number
have,
is the same as mine.
right, we have 4 people, environmental health specialists who are focused on this area primarily. Well, two of them are focused on Henderson and Nisqually, and 2 are primarily focused in the rest of the county for the more complex systems that have operational certificates. In addition, we have a portion of me as the supervisor. We have, we need a full-time admin person focused on this. We have a sort of, that's a changing dynamic there, but we have a portion of somebody right now. And we had a business, what's his name? Joel, he's in IT now. So he used to be full-time in our program, and then we restructured. So he's still primarily serving our program, and we definitely need that person as well.
So that adds up to 6, or how many, like?
4, 5, 6 plus. Yeah, 6 and a supervisor.
And if you add in the time of transfer, it's 2.25 additional FTEs.
Yeah, well, and then I should say, when we do the dye testing, we pull in additional water quality staff because that has to be done within a certain time frame during low tides in the winter. So you need everybody on board to go out to get them all. Likewise, there's a little bit of time. One of our operational certificate or septic O&M person does helps out in the summer with some of the swimming beach monitoring. That's more than our water quality people can do. So we share that.
Okay, so thank you. And then going back to kind of where I feel like we left off last time was we were on this chart and I was trying to understand why, if, we spent a lot of time at the front end of each of these presentations going over the OPC percentages for the various groups. And that's really important. You started off today with 2 charts about why that's really important. Okay, the first 2 charts you showed. So I guess I'm just like, why is it that you've got OPC for large complex? Why is expanding that requirement to others not a proposed element on this chart? I understand it would take more administration, but is it illogical to do that for some reason? Whether it's shorelines or everybody or whatever. I mean, is there a reason why you wouldn't just require the certificates for the most sensitive areas or expand the number of parcels, septics for which such a thing is required? Because, and then that kind of connects to my question about staffing, because in your briefing you talk about, well, if we do education, PIC, oversight, it's going to take 7 more FTEs. So I'm just wondering, is there a more scaled back set of activities that would get that percentage up? If we can't afford 80 FTEs, then is there a requirement that would help us at a lower administration cost get that all critical operation and maintenance number up in the most sensitive areas such as the shorelines? Because if we're looking at 6 employees now and we're dealing with, the number is what? 16,000 septic systems that have the OPC requirement. Anyway, I'm going to stop there. I think you understand my question.
Yep. No, I thank you for that. And it's amazing. Every time I look at these charts, I realize there's ways to do them better. And one of the key things that's, and you hit on it, is that if we were to implement the on-site management plan, what it tries to do is to kind of incrementally increase the number of on-site systems that have required or operational certificates. And it would start by looking at the highest risk areas like Eld Inlet and Summit Lake. And that isn't shown very well. In fact, it really isn't shown on this chart. So there should be a row here that says something about, expanding operational certificates to high risk areas or something. And so I guess, yeah, it's amazing what you don't see sometimes when you're putting these together. So that's something that this column and this column would be trying to do. Now we didn't parse out the cost for each of those elements in the plan, and then I can talk about that. Well, actually, I'm prepared to talk about that a little bit, or we are, as maybe an option for how to do stuff. So, but that was an idea in the plan, is that recognizing that to put in a program that would require operational certificates or renewable operational certificates for 54,000 on-site systems, or adding about 40-something thousand to the list we have now, would be a huge task. And we'd have to, we need a building for everybody, and that wouldn't make a lot of sense, at least not trying to do it all at once. And so the idea would be to phase into that more gradually and have a more manageable number of staff to do that in a budget that wasn't as big. So that was the idea.
And Art, I mean, just looking at those numbers, I mean, there's 16,000 now. And if I look at your chart on all the shorelines, and again, this would include Henderson and Nisqually, which would be double counted, but all the shorelines seem to add up to like 14,000 septics that are within 200 feet of any type of stream. So it would be less than doubling the effort. I mean, obviously wouldn't be the 55 or 60,000 septics.
Mm-hmm. Yeah, no, and I think that would be the question.
Chair, what are you referring to?
I'm referring to the briefing material for today's.
Just for today?
It just came for today.
And I've got there's a table coming up that has
okay, thank you.
For you.
Anyway, so whether you can do that today or whether you can do that for me, next week or whatever, I'm interested in what the price tag would be, so to speak, for that element that you were saying that, you might be able to add to the charter. That would be a different way. Anyway, I think Commissioner Edwards had a question.
I've just got a couple questions to ask about your analyzing this particular problem. And as you're looking at water quality in a specific area, like Henderson and Nisqually, are you taking into consideration the homeless camps that are using our freshwater areas as a bathroom before it gets in to that salt water? So I'll just use an example, like behind Fatso's Tavern there's well over 100 people back in that jungle area. And they use the fresh water there as their toilet. And I think that we should be considering that. Now, maybe you are, maybe not, but are you? Do you consider? And that's just one location. There's a bunch of different locations where that is taking place in Thurston County. And I'm just wondering if you're putting that in. I mean, one of the things that came up yesterday was a Black Lake mention that there was some failing systems on one of the creeks going in. And so I know that isn't part of your Henderson watershed, but I'm just wondering if we're assessing all the facts instead of some of the facts, because it looks to me like of the 11,400 systems in the Henderson and Nisqually area, the on-site septic systems, the percentage is almost nil of problem cases. I'm not saying there aren't some, but if we get too carried away here, it's kind of like, well, let's lower the speed limit on a highway where it's 50 to 20 because two people are speeding on there, and it just doesn't make any sense. So that's kind of where I'm coming from as we analyze the whole problem. So do you take that into consideration, I guess, is my concern.
I could speak to that a little bit, if that's okay. Our water quality monitoring that looks at the stream. So we look at Woodard Creek, which flows, the headwaters are back behind Fatso's Tavern. We look at that closer to the mouth of the stream. We look at, the ambient or the routine monitoring looks once a month at 36 stream sites around the county. And that takes into account all the things that might be impacting that stream. When we find that there's problems, then we need to do the pollution identification correction piece to go figure out exactly what the problem is and then how to take care of it. The program, so the operational certificate program or the operations and maintenance program for septic is specific for septic systems, and the people paying for that are the people who have the septic systems. The homeless camps, indeed, the sewage from the homeless camps is indeed a problem, and that's trying to be addressed in other arenas. Inspecting, their porta potties isn't probably going to help. Somebody's already doing that. Encouraging people to use them might help. I don't know that charging them fees is going to help because I don't have any money, right? So that we do need to address that. That wouldn't be addressed in a septic program.
Well, all I guess I'm saying is okay, there's hundreds of them in that whole watershed, but I know there's like over 100 in that, just that one camp I'm referring to. And I can't help but think that that is much more of a problem to the water quality issue than, I don't know, a minor deficiency in a on-site septic system, where there's no septic systems there at all. It's the waste is straight into the fresh water, which I don't know what your readings are down at the other end, but I can't help but think that's more of the problem than on-site septic systems. And I'm kind of gonna be going that direction on Black Lake as well, as we try to analyze the problem there.
So, yeah, real quick, but let me respond to that. Since he brought up Black Lake, so the person that came in was referencing $53,000 they spent on a contractor to do a study. I haven't looked at the study. I don't know if you've looked at the study, but what the woman said yesterday was that it wasn't a homeless camp. It was 13 out of 16 failed septics along a particular creek that was affecting water quality. Now, I don't know how they got that information, but that's what she said. She didn't say, county, take action because there's a homeless camp that's affecting the water quality and affecting Black Lake and negating a $1.4 million alum treatment. She said, county, take action because we did a study and 13 out of 16 septic systems are failing on that creek that's flowing into Black Lake and negating one that we're gonna be paying a bond. I mean, that was a powerful piece of testimony.
I agree, sir, it was.
I mean, we sat here and debated whether or not to authorize their ability to do that bond, and they're a special district and they get to do that, in my opinion. But I understand the frustration to think that they're gonna be paying for years to pay that back through their taxes, and it's all gonna be negated if we're not willing to, address some of these other issues. She identified the septic issue. Again, I didn't do that study, I didn't see the study, I just listened to what she had to say, but we know from a previous week's testimony from somebody else who's actually a commissioner on the Lake Special District that they did commission that work, because Mr. Stincy talked about that. So anyway, there's that, and I guess you guys have been working on, as Art, my first couple months on the job, he came and gave me a long, historical lesson. I mean, you guys have been working on this problem way before the explosion of homelessness in Thurston County. So we know that there's issue to be addressed here, irrespective, and I'm not discounting some of the things Commissioner Edwards is saying and how it can affect water quality, but I think that's why you started out with this slide, which I think is very good to show us that 8.5% today, serious deficiencies. And I thought this second slide was interesting to show that even where we're shining the light and putting the microscope, the second one there, go to the next one with the bar graph. Even where we've been working on this, we've got special fees, special programs, shining the light, we continue to see consistent problems with the septic systems. They don't just go, it wasn't like there was a big problem and we got on top of it and now it's just everybody's good to go. I mean, there continues to be problems because these systems need maintenance and consistent oversight. So I think this graph pretty much illustrates that. So anyway, that's kind of my response. Commissioner Mejia had a comment, question.
I do have a comment, questions, and I've been talking to community members and constituents about this, and what's our partnership in relation to private businesses? I mean, the people who go out there and pump, and I see here, you know, the pumper reports and the time of transfers, like what is our relationship with those businesses?
So we very much rely on them to do a lot of the work, just like we rely on the residents, the community members to do their parts. We do certify pumpers and monitoring specialists and installers of septic systems. So they have to go, you know, take a test and pay fees and be inspected and all that through our programs. So we're in a little bit of a regulatory oversight of them. And then in a lot of ways, they're our partners in that, you know, like when I have, when my septic needs to be pumped, I call a local business and they come out and take care of it and they turn in the report. So we rely on them to do that reporting. If you had county staff who had to go out and do those inspections of nearly 55,000 septic systems, we'd need a huge staff or we wouldn't do any inspections at all. You know, it would be a minor amount. Does that help?
Yeah, because I heard kind of a different take on it, which I found interesting, where, you know, the pumpers weren't really turning in the reports because it had to go through this whole process of wait time with the county. And so they didn't really feel like there was that collaboration between them and the county, which I found alarming. And so I just wanted to see, like, what is that relationship and can we build on that relationship? Because like you said, you know, we rely on them. And, you know, I feel like they are out there way more than the county is. And is there a way that we can target those who don't have the reports in? I mean, I feel like that the people who are already doing the work to get their septics pumped and fixed, you know, they already should have things on file. And, you know, if they're not turning in the reports, maybe we should be asking, okay, what's going on why these businesses are not turning them in? What is the holdup on our end?
There's been two parts to that, I would say, at least, and Steve and Art can jump in. Really, since about 2008, with the economy downturn, we have been constrained with staffing and have not been, with the exception of the folks who have the operational certificates, again, paying a fee, and we're looking at those really hard because they're high risk sites. The rest of the county inspection reports, we have tried to keep up with those and have not been able to. So now that we're getting more fully staffed, we're turning our attention back to those and following up with the very serious deficiencies. We also had Joel, our IT guy, do some programming that helped us narrow down, instead of having to read each and every inspection report, you know, all those thousands of them. He could mine the data and present, and we could run reports showing the most serious deficiencies and follow up on those. So that's, you know, I have staff out today doing that. The other part then is all those folks who are not getting inspections. That's something that the septic plan tries to address by doing the education and regularly sending mailings to people to say, hey, it's time for your septic system to get inspected. Here's who can do that. And, you know, here's more information about why that's important. So that's how we would address that.
Commissioner Edwards and then County Manager.
I guess I'm hoping that you folks will be reviewing this report from the Black Lake Special District done by Herrera.
Yeah, I've read it through once and I want to go back and study it a little bit more. They used kind of the DNA biomarkers to determine that in those three drainages, the bacteria that they were finding was likely sewage based. And then we have teamed up with the Black Lake Special District in times to provide them with reports of, septic systems and who's been inspecting and not. And they've sent letters out to their members. So that's where the 13 out of 18 or whatever it was, that number is not necessarily failing systems, but systems that have not been inspected or pumped within the last 6 years.
That's what I'm understanding, that it's systems that are not failing necessarily, and
Maybe, we just don't know.
well, yeah, they haven't done their inspection, I guess, okay? But we find that percentage of failing systems is very small when it is done throughout the county. So I'm very concerned that they're being tagged for this, and there is a problem, so we want to get to the problem, but also that problem could be from any warm-blooded animal or bird. So that's
Well,
another big
their
piece of it.
DNA study,
Well, it looks
kind of
like they
indicated that
looked
it was
initially
human
for
sewage.
optical brightness to get going on it, and then they went back for follow-up. But, so I would hope you folks will spend some time working with those people, because the lady that came in, I'm very concerned that we would be missing the boat, so to speak, to that extent after they spent that money. So hopefully we're all trying to solve the same problem together.
I guess, going back to your very first chart, the 2019 reports, 8.5% of serious deficiency, I don't find that to be very small. I mean, Art was just saying that it takes one system with a serious deficiency to completely foul up what you were describing is there was one system that was basically causing the whole closure of a shellfish area. I mean, so 8.5% serious deficiency and another 9% deficiency, that's not very small number.
You're right. That sounds terrible. It's getting to close to 10%, let's say. But the fact is, we've been through this whole thing. We went through it in 16, and we had a number of 14% failure. And we found out after everything was analyzed and added up properly, it was less than 0.5% that was failing. So that's why it's so critical that we get this information about what is a serious breach versus what is not. Just like the lady that brought the information forward, not having your system inspected does not mean that it's having a problem.
Yeah, I'm looking at my notes, and she said, because I wrote exactly what she said down, and it was, I guess, she said not up to county standard. It said 13 of 16 do not meet county standards for maintenance.
Yes. Yeah.
So fair enough, but let's just say it's only 9% of, like everywhere else in the county, 9%.
Well, I don't agree with that number in the end. I still think we haven't had that much of a change from the 0.5% countywide when we talk about 55,000 systems. And we're still less than 1% in the whole thing.
But I don't understand, this is not county generated numbers. I mean, Art, you can describe this better than me. I shouldn't be making the case for you.
I'll ask the county manager. I mean, he wrote a letter back to a citizen that recognizes
And
0.5%. And so what's the real number here?
So
when we get to it?
I think we're, with all due respect, I think we're comparing two different sets of data. Here, what you have is actual inspections, which equates to 18,135 inspections. And you have a serious deficiencies based on the actual inspections. But if you extrapolate this, just the deficiencies, the serious deficiencies to the total number of the septic systems in the county, the percentage is gonna be low.
Yeah, it's gonna be low.
And that was the gist of that I believe that conversation. But also you can extrapolate this to the overall number of systems in the county, and that's probably what we're missing is the additional data beyond the 18,135 inspections to have a true set of data
We need more information, I think.
And that's what probably, I think the whole conversation is really as the board wants to expand the program, to have a more robust series of inspections, they will give us the true data of the failure systems. Because from the 18,135 inspections to the 55,000 total, there's a lot more that can be failing we don't know.
Statistically,
Let,
it doesn't look like it's that bad. But it is, when it looks like you've got half of a stream or something, that's bad, yeah.
okay, Art, let's, yeah, sorry.
I do have a question.
Yeah.
So, Art, on page 40 of your briefing paper, under item 8. And item 8, you have the sub-item A. You speak about approximately 1,611 OSS located near the marine shoreline do not have operational certificates, right? And on B, you have approximately 4,428 OSS near marine shorelines, lakes, and streams, more encompassing. Is the 1,611 from item A is inclusive into the 4,428, or we need to add both? You know what I mean?
I kind of got lost on where you were
Yeah,
describing.
right there, item A. At the bottom of the page, right there.
Okay,
You have, you stated approximately 1,611 systems located near the marine shorelines do not have an ROC.
yes,
The next item, you said approximately 4,428 systems. This, again, the near shoreline, and then you add the lakes and the streams, don't have the ROC,
yes.
right? So is the 1,611 from item A is included on the 4,428?
Yeah, that's, item A is a subset of B.
Okay, so what will be the, and that goes back to my next question in terms of resources. If the objective was to concentrate on the 4,428 systems that are near marine shorelines, lakes, and streams, they will take up to the level of having a ROC, a renewable operational certificates. What will be the level of effort in terms of resources to achieve that objective? Is that included in one of your 3 options on the resource needed under item 9, or that's different?
I didn't do that specifically, and it, and what kind of comes down to that is how quickly do you want to deal with those, because that would tell you the amount of resources that you need. So one of the things that we are listening to the budget presentation on Friday, I think Commissioner Menser asked, well, what would it take to implement a program to start doing the shoreline systems? And so I talked briefly to Jane, and we put together a quick proposal that I haven't priced out exactly yet, but we were thinking that you would, if you wanted to start working on shoreline systems and kind of make progress on that while continuing to do the things that we're doing with staff, we would need a couple more staff to do field work, another administrative staff to kind of deal with all the letters and paperwork and data entry and things that are associated with that. And then there's a fairly significant laboratory budget that goes with this. We do a lot of bacteriological monitoring. We do dye tracing, and the positive dye trace results are verified by an independent lab, because we really, really want to be positive when we go in, or confident in our results if we tell somebody that they need to start evaluating their septic system and possibly replace it. So that's about a $50,000 budget with that. So I don't have the final prices figured out, but that's somewhere in the neighborhood of $400,000.
What I got, following up on Ramiro's point, I got kind of, I was kind of confused and looking at item 9, because what I'm looking for is, the biggest, positive result, bang for the buck, so to speak, for the, lowest amount of resources. And here to say that to fully implement would require 8 FTE. And if we focus on shorelines, 7 FTE. It's like, well, wait a minute, that's, if we're just focusing on 4,000, a very limited number of additional parcels, why would it cost 7/8 of the amount of money? That's the exact opposite of what I'm trying to achieve.
I agree with you 100%.
Yeah, like I'm trying to get more bang for less buck. This sounds like less bang for more buck. So it felt like a disconnect in terms of now you're saying, maybe it would be half of that based on this kind of stripping it back. So I would like to hear, does that make sense what I'm saying, Art?
Yeah, no, I understand that. And, and if you were to ask me, I think, if we were to try to get the biggest bang for the buck, we would do as you've described. We would focus on the septic systems that pose the greatest public health risk when they fail, and those are shoreline systems. There's a question about, that's part of the reason I I'll get to that here in a second. Here's the information we were talking about. The question is, does every septic system along the shoreline represent the same risk? Marine shoreline and maybe Summit Lake. And here's Summit Lake and here's Eld Inlet. Those, I think our staff would say these are the highest priorities, but you could add some more to them. Certainly the folks here at Black Lake are thinking that they deserve more attention. But anyways.
Yeah, or maybe even maybe it's not every creek in Thurston County, but I'm thinking of the more heavily developed lakes, where you've got, I think the potential for a greater concentration and more public access and things like that, so you might even be able to strip it back from even all of the potential shoreline parcels. I mean, just to get it within a price tag that the board could afford to do.
So that would be something, again, it gets to the cost and the level of effort comes back to how quickly do you want to do something. So if we said, okay, we could, if we had a couple of staff and administrative support and we started to build programs and incrementally implement them, then that's one number. If you wanted to try to do more than that, in other words, that might take more staff. But I can work with Jane and and Suzette, our new finance manager, and Steve to come up with some numbers, and Shelley, of course, to do that. But I think, if you were just based on our experience and based on what you're hearing from community members, I think the two things we would want to focus on would be the highest risk on-site systems. So again, some of the shoreline ones, then also figure out some way to have the capacity to do the pollution identification and correction work. In other words, the water quality monitoring to follow up on problems, to be able to do periodic surveys of shoreline areas. So in days past, when we had shellfish closures and actually some of the first steps in creating the shellfish districts and the marine recovery areas, is that we did shoreline surveys. We had staff wandering up and down the shoreline, sampling things, sampling streams, doing a little bit more intensive work than what Jane described, which is once a month, sampling at the mouths of streams, ambient monitoring. So that would be another element to incorporate. And we're actually, Jane was putting together a budget proposal for adding some capacity to do that. So those are the things we can do, and price those out for you.
Awesome, thank you, Art. I don't know who is next, Commissioner.
Well, no, I have a question.
I can't remember whose hand was first.
Go ahead, Commissioner Edwards.
Okay. I guess I kind of want to follow up on both the manager and the chair's comments, but statistically, we've got pretty good information when it comes to the Henderson, Nisqually area. And out of that area, we've got 11,400 on-site systems. And Art, you said you come up with about every 6 months, 20 to 25. Okay, so let's give it the higher number of 25 that end up being a problem of one type or another. Well, that's 50 a year that we come up with. and 50 a year out of 11,420. I haven't done the numbers or anything, but I think that's looking at less than 0.5% per year. Even though we've got some pretty heavy review of those particular issues. So that's kind of where I'm kind of hanging my hat that we haven't changed too much from way back on the original numbers, because I truly believe citizens do the best they can to keep their systems working, because if your toilet doesn't flush, I think that goes right to the top of the honey-do list. You better get this fixed. And they're making a phone call and getting somebody out there to do something. Now, that might be the more extreme situation, but I think the citizens are pretty darn responsible about this, because we have to remember, even though we're kind of talking about a little more attention being paid to shorelines, we all live in a drainage. Wherever we live, it's a drainage. Some are farther away from running water than others, or standing water, but we're all living in a drainage, and I think all of them are very important. And I just don't think that government pays enough attention to the real problem, which are these homeless encampments. Now, I don't know anything about Black Lake. I don't think they're far enough out. They might not have any. But I think there's a lot of warm-blooded activity. If you look at what went on at Kennedale Park for the swimming, that fecal chloroform count, we didn't have septics right around there close, but we had a high problem area there for a while. But our staff readily admits that could be any warm-blooded animal. I mean, that could be a flock of geese that were there, an hour before, whatever it is. So I think we gotta I think we're obligated for the citizens to make all of our decisions on all of the information, not just some of it. So that's kind of where I'm coming from. And then we throw in time of transfer. That's getting to about 5 years now, where the average is about 5 years. And we're getting a lot of this information, a lot of data. I'm not saying, I want water quality addressed, but I want it addressed where it's gonna do the most good.
Commissioner McGinn.
So just to follow up on Commissioner Edwards' points, I mean, for me, I'm seeing the numbers, right? And for fully funding, and I'm kind of not seeing as many options out here. I mean, I remember when Commissioner Menser brought up, okay, how about if we look at, incentivizing or putting up something that incentivizes people fixing their, I'm not seeing that on here. I'm just seeing it kind of like one way, and I'm almost hesitant about it, because, I feel there might be other ways, maybe getting up to date and fixing that relationship with, our private businesses. Houses are selling so much right now. I feel like there's a lot of data that's coming in from those time of transfers. So I don't know. I feel like maybe collect that data and see like where we are after that, because these numbers, I don't know, it just seems like a whole lot and not a lot of clarity to me, but that just might be me.
Art, did you, we kind of interrupted you, and I know you got more slides. Do you want to kind of go back to where you left off with some of the maps you created?
Sure, I can, I'll do that. And yeah, there've been lots of questions and things. I could probably, between Jane and Steve and I, we could probably answer a lot of them, but.
Yeah, you're welcome to respond to anything you heard just now too. I don't want to stop doing that.
We do actually, if you look back at those slides, the ones that I didn't show you, but just breeze through the percentages that are current and all that, that's like just 3 weeks old, that data. So that was updated on June 3rd. So all the time of transfer stuff and all that, which require professionals in most cases to inspect systems, and whatever they found, that would have been put, not the results of it, but the fact that they were inspected or not. So those numbers are reflected there. So we can see that the percentage of on-site systems that have current inspections aren't changing that much. Now, I can't analyze it much more than that, but that hasn't changed a whole lot. And Commissioner Edwards does bring up a good point about homeless camps and things, but I know that there is, if you go by that camp, there are efforts to try to provide options for proper waste disposal and all that. But the other thing is that Woodard Creek, that's the one that comes up into Woodard Bay, and the areas adjacent to that are still open. So if there are, I have no doubt that there may be impacts on surface water quality in the immediate vicinity of the homeless camp stuff. But as far as having an impact on the shellfish harvesting areas and causing downgrades, we're not seeing anything on that. So, and it may be because of the wetlands are doing a good job. It may be dilution. It may, who knows why. But at least right now, we're not seeing any impacts on the shellfish harvesting status in the area where that stream would impact things. So I'll just leave it at that and then kind of go on to the next slides. So, and I can, and as far as the pricing and stuff, I could, and I'll take the blame for this, I could have come up with a bunch of different options on a menu sort of thing, but I didn't know for sure where we wanted to go. So I just put some generalized things and what it might cost kind of for the full meal deal and kind of the smallest cost. But I can certainly work with our finance folks and with Steve and Jane and Shelley to put together some more defined options for you coming up. With this chart, though, is kind of getting to that is there was some discussion, I think, about how we could go about implementing programs. And there's, I think, a question about, what can we do with grants? And it's possible to do a lot of different things with grants and on a limited basis, and recognizing that it can take time to get them. And so, for instance, we've done dye tracing. If you want to say the high-risk shoreline areas, we wanted to focus on Eld Inlet, for instance. We've gotten grants to work on Eld Inlet. We could get a grant that tries to seek to do dye tracing of areas. We've done that in the past. What tends to happen is when you ask people to volunteer to do something fairly intrusive like that, they don't volunteer. And I've got old data that we could give you on that. OPC for large and complex system, we can do that to some extent. These things are already covered. We could do more quality assurance work. Again, typically the grant funding is such that you're having to identify a particular problem or a particular area that you're trying to address. So that's why we put the terms limited here, is that you would be, your defined study area or the specific type of system that you're trying to evaluate. That's why you're limited. Same with pollution identification and correction. You can get funding to try to identify a particular area or to maybe develop and implement a program, but then long-term funding is usually not possible through grants. Go ahead.
While you're talking about funding, your slides don't seem to show it, but your briefing memo had a chart with all the other counties. Could you maybe touch
yeah, I
on
got that if you'd like to see it.
Just kind of show that, kind of outline that for the board. Oh, you have a slide on that.
Yeah. So if you want to look and see what other counties are doing, and I spent some time on this, and it's not complete, but you can see that depending on the county, and these are Puget Sound counties with the exception of Clark, and Clark years ago started a program to fund the implementation of they don't have an on-site plan, but they try to make sure that people are properly monitoring and maintaining their system. So they created a program using a property tax charge. Other counties have done everything. Clallam County, for instance, their board has chosen to fund part of their operational certificate program using general funds. They've just, for the past 2 years, they've put $100,000 of general fund money into that program. And it's continuing today. I actually went and looked at their budget documents to see if it was still in there, and it still is. Jefferson, they're utilizing an option in state law that allows them to fund the implementation of their on-site management plan with a charge. So they're charging via the property tax statement. They started out at about $34 a few years ago. Now it's up to about $37. And that's per septic system. And so they did every septic system, shoreline, inland, wherever, they're being charged the same amount. Pollution identification and correction. So like the shoreline work we've talked a little bit about and what some community members are asking about. Kitsap County has kind of the gold standard program for that. They charge about $115 per parcel stormwater charge, and a fair amount of that goes to the health department, or they're a health district actually, to fund their program. That ends up being, that's over $1 million a year, I believe, to do their PIC stuff. It's quite a bit of money. Mason County.
Art, before you move on from that Kitsap County deal, so the law allows a segment of the stormwater money collected to go towards your programs? Is that what I'm hearing?
But what Kitsap's done is they've identified I think it's called Clean Water Kitsap is the name of the program. And they've identified a bunch of activities that they want to take place. And one of them is to do routine monitoring for pollutants. It could be, just because they want to see if streams are impaired, and then they can use that to identify the sources. And so so it's not doing septic system monitoring and maintenance, but it is doing what that stormwater fee is allowing them to do, is to do the surface water quality monitoring to identify impaired water bodies and to then identify the source.
So that sounds like that might be an option if we wanted to dedicate, say, a person to do X, whatever you're proposing. I'm just looking for options. So
yeah, no, that is allowed. In fact,
that's a possibility.
Yeah, I think that's a possibility. And that's how they're structured.
I mean, even things like rates. I don't know how rates are calculated on stormwater, but maybe that's something we can look at. I don't know. I want to do the job. I want to make sure that the cost goes to the right area.
Yeah, okay. Well, yeah, options are good. Yeah, keep going. That's good.
Yeah.
Good
Go
question.
ahead.
And you can just see there's a mix and match here. San Juan County has a small charge per septic system. Pierce County, what they did, and this is just an example, is they added or have a fairly significant charge for each septic system pump report that they receive to fund their parts of their program. Skagit County, they charge amount, they're a clean water district as part of a shellfish district, so they charge some money per parcel that pays for a variety of activities, including some septic system stuff and stormwater monitoring and other things. In Whatcom County, they were the first one to implement a charge for each septic system using the authority that came about in a bill a few years ago sponsored by Senator Frazier that allows a charge on the property tax statement to fund the implementation of the septic system management plan. So that's what Whatcom's done. So again, you can see there's different approaches, none of them match. They use different ways of funding their programs.
And if Thurston were on this list, how would you characterize what we're doing?
We would be closer to the Skagit thing. For Henderson and Nisqually, we have a property tax charge that's associated with a shellfish protection district.
Okay.
And then we are doing some version of what Pierce County is doing. We have other charges that we implement at the time of property sale or when pumper reports come in and all that to fund our program activities. So we're a hybrid.
Got it.
And I think if you were to go into the details, you'd find most of those programs are hybrids too. They'll apply for grants, they'll have other fees and things, but they are using some different methods to fund the on-site plan portions of their activities. And so here was that, again, like where we're at, and And here are some
County-
ideas.
Real quick, County Manager had a question before you leave the.
Sorry, I couldn't see him there on the little box.
No, it's fine.
I got too many screens going.
Can you go back to the previous slide?
Slide 15, the chart.
No, the one you have, the current program, one more.
Which, excuse me,
Yeah,
That one?
on slide 15.
That's
Yeah, there you go.
Okay.
okay, sorry, I thought I had it,
Yeah,
sorry.
on the current program, and you stated that we currently have 6 FTEs, including the supervision. And if we add the time of transfer staff, we are about 8.5
I
FTEs.
think that's about right.
Right? So help me understand, or help me connect the dots, that on the proposal to fully implement the 2016 plan, you just about double the staffing levels. Help me understand that connection, because looking at the current plan, there's already, under the current staffing levels, we're already providing and implementing portions of the plan, not to the full extent, but we are providing the implementation of some elements of the plan. So help me connect the dots to the 8 FTEs that you are suggesting we need to fully implement the plan.
So the 2016 plan, well, it did a couple of things. So first of all, it was going to be, so we're at 8 FTEs now. It was, in part of what it was including, the staffing plan for it included some of the time of transfer work, which isn't a big deal, but then it was going to try to do pollution identification and correction. It was going to incorporate implement programs to start doing the Eld and Summit Lake operational certificate program. It was going to be doing more education and outreach to be able to provide opportunities for people in those areas to do their own, certify their own on-site systems. And it was trying to provide the resources, the administrative support also, and it also included in there was another staff person for doing the data management stuff. Because what we've, back then, as Jane indicated, the person who does our IT work for us was in our department and he was overwhelmed. And so we were adding additional staff for that. So those are the things that come to mind. I don't have the spreadsheet in front of me, however.
Thanks.
I could add just a bit. When we add a new area to require operational certificates, the startup piece of that is much more time intensive than the ongoing portion. And that we need to get in and really inform everybody that this is going to happen and get into the records and the Amanda piece or the permit tracking software, or computer piece notes that there's a property with a septic system, but we have to go back to the actual looking at the record drawings and the details of each system to build it in detail within the computer. So we make sure, and then also do that in the system that the septic professionals submit the report. So there's a lot of background work that has to happen. And that's why if we're phasing in over time, we'll need more staff to do some of that to get it up and going before we then are rolling smoothly with the process.
Okay, that was the questions. Keep going. Thank you.
So that's part of it. I could provide more details on that if you'd like, but Jane was correct, is that the startup there's more staff involved with some of the startup stuff that would diminish over time. I think I plotted out like 6 years worth of program costs and stuff at one point. So here are some, we talked a bit about this. You've already brought most of these up. Was some ideas for trying to move our programs ahead that would implement at least the intent of the on-site management plan and other things that we've learned over time. So again, one idea would be to focus on some of the higher risk areas and perhaps use them as the beginnings of a shoreline program, looking at Eldon, Summit Lake, expanding education and outreach programs to all on-site owners. And that could be, there's different ways and scales of doing that. Jane mentioned that one thing that we could be doing a better job on is following up on problems found during these on-site inspections by professionals, and working with them to make sure that we educate and inform property owners about the problems that they're finding. And so that's another thing we could do. We've talked about pollution identification and correction, and a variation of that. What we talked about earlier was we could focus on high-risk shoreline areas to identify failure. So that could be doing pollution identification and correction work or shoreline surveys. We haven't done that sort of work in areas outside of Henderson and Eld for quite a few years. We've done some follow-up work in some portions of Eld, but not extensively. And then this is the thing you saw before, the Eld and Summit Lake areas. And the purpose of this slide was to give you an idea of the scale of things, and also that we would need to be, if we just chose, for instance, to do shorelines, we'd want to pick which ones, and depending on what the priority is, the numbers vary quite a bit. So, marine shoreline and county streams, you start getting into some pretty big numbers. And then, as we were talking before, which streams or shoreline areas would give us the biggest bang for the buck if we chose to implement new programs there. And then here's just some references as far as the number of systems. So we think there's about 636 systems on the Henderson-Nisqually shoreline, and within the whole Eld watershed, we've got another 3,500. There's about 500 properties and 400 and something properties in Summit Lake, for instance, that have on-site systems, I believe. I should have put that there. So,
are we going to have time to make comment on that? I need to just say something real quick about that.
Yeah, we're down to our last 15 minutes. Go ahead, Bill.
Places like Summit Lake and designating that as a problem, I guess we've had studies in the past, including, I think, the one that was privately done by Black Lake just recently. It's been thought that, well, these on-site systems were the problem to the lake. Well, other than that one stream that's coming in, they didn't have problems on the lake. I think Summit Lake has done something similar. I know Lawrence Lake did. In each one of those cases, the county said, you guys have a problem here with on-site septic systems, you need to do something. When private dollars were spent with environmental groups to move forward, they found out, no, that's not true. There are things like nutrients in the lake from maybe sawmills or fertilizer used too close, that type of thing. And I think a big piece of what we're talking about here today boils down to things you've heard me talk about many times, and that's trust. We need to make sure we get it right when we go to the public and ask them to pay more. And I'll just use a real quick example. The town of Rainier, I'm catching a lot of flack out there because our hydrologist is telling those people, well, they can't have any more building in Rainier because they're on-site septic systems. They don't have their own sewer system yet. But I've not heard one thing that has actually justified our hydrologist to be telling the city of Rainier, the town, that they can't do any more building. That causes that big problem with trust. I can tell you there's a meeting coming up right now, and maybe Art's involved in that, with the mayor and others out there at Rainier. Am I stepping out of bounds, Art? Is that right? I mean, are you involved in that?
I will be attending that meeting this afternoon.
Yeah, so, I mean.
But I will be curious, with all due respect, I will be curious, the hydrologist shouldn't be in the position to determine the level of development.
Well, I don't know. I mean, I'm not naming names. I'm just saying those are the kind of things that create doubt when you get the community stirred up. They've got projects they want to do, and then they're told, well, you can't do it because you might have a problem there. Well, you might have a problem, with every coal-fired plant or nuclear reactor too. You might. So those kind of things, we have to be very careful on damaging public trust as we move forward. So that, I just throw that in there.
Okay,
So it's some, we could, yeah, I won't talk about Rainier right now, but I do appreciate Commissioner Edwards' concerns about public trust. I will say that the reason that the folks who did develop the on-site management plan thought Summit Lake would be a priority area is because it's a drinking water, it's a surface water drinking water source, and that many of the homes there drink untreated lake water. And if a septic system fails into the surface water, that could be a significant public health risk for homes that are withdrawing water near the area where the septic system's failing. So that's why Summit Lake water quality wise, if you're talking about nutrients and things, it's very, very clear that I don't believe anybody was making an argument that it was related to nutrients. It was related to the risk if a system fails, given the geology there and the fact that most people are withdrawing lake water as their drinking water source. That's why it was considered a priority.
Okay, thanks, Art.
and Art, you had I'm thinking back the material you provided me a while back where you showed me all of the work that was done by the community stakeholder group down in the South County, I think it was Rochester-ish area, about, water quality. And there was, I remember there being findings that, here's what we need to do. Their septics can cause this issue. We need to then they worked out a set of goals and approaches. But it was fundamental to all that the community was recognizing that this does need to be, scrutinized and addressed.
Yeah, that was probably the Scatter Creek work that we did with an advisory group and came up with a set of recommendations, which was commemorated by the Board of Health at that time with a resolution. So that'd be another 2-hour briefing. So we won't talk about that in depth now. And I'd be happy regarding the groundwater issues in the South County and policies that we have in place regarding septic systems and state law and how we've attempted to address that. That's probably what this City of Rainier discussion is about. And I'd be happy to talk about that too, but wasn't prepared to do that in detail today.
No, that's off topic. Please continue. We've got about 10 minutes left.
And so again, here's a map that just shows that if you look at the shoreline master plan and the designated waterways,
I got it. 19 about it.
you can just see there's a lot. And so we've talked about this, and I apologize that I didn't have a more specific proposal for you today, I guess. But you can see that adding a couple of staff, our costs are fairly high when you add all the indirect and all the other things into it. A couple of staff is going to be in the neighborhood of $250,000 a year, and you can go more than that. And it really gets down to the nature of the program and the scale of it. If you go back, and I kind of if you looked at that $10 charge, you'll see that it was thinking we could accomplish a lot of things, but I guess the piece that's missing here is that it would accomplish them fairly slowly, and if we could augment it with grants, we might be able to speed things up. But so that you can see there's a lot of things that a small charge would allow us to start working on, and this of course was based on 2016 costs. But again, it gets down to how quickly you want to move and how many things you want to incorporate into a proposal. And so that's where it is. And the other piece here is that when you're doing things like pollution identification and control and shoreline and programs that involve dye tracing, you need to recognize there's some lab support and perhaps even some special equipment that you need to do that. There's some really nice equipment that you can use in pollution identification and correction that would save lab costs. The bad news is it's expensive and it needs to be maintained. There's new stuff being developed all the time. But we've got some machines like that, but they're in the neighborhood of $15,000 to $20,000, and sometimes they can be finicky, and when they break, they can be expensive. So again, there's lots of options for ways to fund programs, and what we've done and what we typically do is even in areas like Henderson, the Dobbs Creek thing is an example. We have sustained funding there, but we augment that with grants when we find problems. So like we're trying to work with the folks at Dobbs on the camping club there to identify a solution for the systems that are having problems there, and to help them do the engineering and the planning necessary to fix it. And that's ongoing, but that's the sort of stuff we do. And then there can be combinations. One thing that is interesting, it won't solve all of our problems, certainly, but you probably have heard about something called Foundational Public Health Services, and the legislature has provided a large amount of money to the governmental public health system beginning this year, this fiscal year, and on-site programs are one of the things that have been identified as a possible priority. Now, decisions are still to be made on that. We don't know how much money we would get in Thurston County. We don't know, haven't made decisions about, what to do. But it's just something that's out there. So for instance, if, there might be an opportunity, I guess is what I'm saying. And we've talked already about this slide, just that, we try to get grants when we can, but it's very competitive. They take time to monitor and maintain. We often don't get as much as we would like. That's what this is trying to say. And a lot of times you'll find that the state's priorities or the federal government's priorities don't align with ours. So there have been times when, like for instance, we were actually, the Scatter Creek thing, I mentioned that was actually, we were fortunate to get that. But at that time, it was very difficult to get funding for a groundwater project because the state was interested in something else. And so we were fortunate to get the money for that, but it was very difficult.
So it sounds like just two things that came up today, just kind of summarize, is the possibility of certain activities can qualify under stormwater fees if it's about identifying problems, and there could be foundational public health money that we hadn't really known about, or not known about, but it's new, and we don't know the amount, but that could maybe backfill a piece of what we're trying to accomplish. Sounds like something to be looking at. That would be apart from additional fees or general fund, which are the two things we're least excited about. Is that a fair summary? Steve, is that your hand?
I have two items.
Okay, 5 minutes.
But based on what I've heard,
Yeah.
the next steps, we need another briefing. It's sooner rather than later. But what I get is perhaps we need to work on determining the level of effort and resources to address the 4,428 systems that are located within the marine shores, lakes, and streams, as to how those systems we can implement the Renewable Operational Certificate, ROC. What will that be in terms of level of effort? Also, what I've heard today is I think we may need to give the board a little perspective in terms of the funding generated by the time of transfer as to how that money is utilized and what areas that money is going to relate to the program itself. Those are two additional items that I had, in addition to the stormwater. Did I miss anything, or did I miss anything on?
Well, and I would just say, it sounded like Art was willing to do a little bit more of a little more detailed menu, if you will, of possible program approaches with the funding needs. Commissioner Edwards.
I don't know if this is for Art or Steve possibly, but how many gravity systems have been permitted in the last 6 months or something?
That would be a Steve question if we know the answer.
I can run some statistics on that for you, Commissioner, but my belief it's probably fairly small number, but I can get that for you. And you just want 2021 year to date?
Yeah, well, I'm just, we had kind of an agreement, we were gonna try to do that whenever possible, whenever feasible. So I'm just asking, I mean, it has to do with the price of homes, and there's quite a difference between, I don't know, 5,000, 6,000 and 18,000, for the pressure system. That's all, I'm just,
Okay, we've got a hard stop because we've got to, start with the stormwater or.
Yeah, we got 3 more briefings.
Guys, I just want to thank you for your work. I just want you to know that the board's going to be setting, as you know, a biennial budget. I am going to be making a proposal to move, our work forward on this in some fashion, and I'm really relying on you to help me flesh out the options that I will have to propose to the board. So kind of keep that deadline in your head. I'm going to need to have the information that I need to make my decision of what I want to propose to the board, as we move into the budget discussions for this fall. So hopefully we can use that as sort of our timing for the next briefing and et cetera, so that we're prepared to do that and have the discussion we need to have. Does that make sense?
Yeah, that makes sense. So I will work with folks to come up with some more options and do that quickly and schedule another briefing. And also look at some of the costs of our time of transfer program and how that works. And was there something else?
Just to the goal of Commissioner Menser to having this conversation, my team can help you put a placeholder in the budget system so that it's there for you to build on.
Okay, and I actually wrote up something that I sent to our staff too, to put a placeholder in there. So we'll get it one way or the other.
Just so there's a placeholder in there. Yeah, we don't want to wait until the fall with nothing there.
Got a 2-minute break and we'll be back at 11 with stormwater. Thank you, we're adjourned.
2 minutes.